Yacine Djibo, and I'm the founder and executive director of Speak Up Africa, a policy and advocacy action tank based in Senegal. I also serve as the co-chair to the Strategic Communications Partner Committee of the RBM Partnership to End Malaria, the largest global platform for coordinated action towards a world free from malaria. Thank you all so much for joining us today. While the world has made tremendous progress in the fight against malaria, saving 7.6 million lives from the disease since 2000, in recent years, the rate of progress has slowed in the highest burden countries, all but one of which are in Africa, where the burden accounts for over 90% of all malaria cases and deaths worldwide. While anyone can get malaria, pregnant women and adolescent girls bear a disproportionate burden of the health, societal, and economic cost of the disease. Pregnant women and adolescent girls and their babies are at greatest risk of malaria in the first pregnancy because the malaria parasite targets the placenta. This puts the pregnant girl and woman and the unborn baby at greater risk of death, illness, anemia, and stunted growth. The risk continues during subsequent pregnancies. Women and adolescent girls also bear the brunt of caregiving responsibilities for sick family members. One estimate shows that women spend more than 4 times the number of days caring for malaria cases in a household compared to men. In addition, women are the ones who are most often on the front lines of the fight against this disease as community health workers, caregivers, and if they have agency, as household decision makers. Yet for too long, the fight against malaria has been gender blind. The lack of gender disaggregated data and overall research focused on the burden and impact of the disease on women and adolescent girls makes it very difficult to determine the true toll of the disease on them. It also ignores the broader societal and economic potential of what ending malaria can mean for women and girls. One thing is clear though, by getting rid of this preventable and treatable disease and its disproportionate impact on women and adolescent girls, we can achieve a healthier, more equal, and resilient society. If we all accept the premise that a gender-intentional and transformative approach will contribute to accelerating an end to malaria, and women's leadership and full participation will help us drive that approach, how do we make that happen? How do we empower women in becoming decision makers and not just implementers in the fight at both global, local, and national levels? How do we make space for women to be able to bring their experience and unique leadership capabilities to the table, allowing for research, policies, and programs to center and address the needs of women and their families specifically? Can promoting women's leadership accelerate efforts to end malaria and advance gender equality, both economically and socially? Let's talk about how now. And with that, it is my distinguished privilege to introduce our esteemed panelists today. We have with us Dr. Corine Karema, senior malaria expert and the youngest person and first woman to lead Rwanda's National Malaria Control Program and then head up the country's Malaria and NTDs division between 2006 and 2016. We also have as a panelist, Ms. Mambwe Kabaso, Country Operations Manager for the USAID-funded PMI VectorLink project in Zambia. We also have amongst our panelists, Dr. Damaris Matoke-Muhia, Deputy Director for Biotechnology Research Program at the Kenya Medical Research Institute, leading critical research on vector control in malaria endemic countries and on focusing on how to increase women researchers in malaria. And we also have Dr. Elena Gomez-Diaz, distinguished researcher at the Spanish National Research Council and the co-creator of the Women in Malaria Conference, which in its first year during a global pandemic engaged more than 450 female researchers working to end malaria around the world. Their full bios are available for you to see at the bottom of your screen. So now we will go on to the questions, and I'd like to start by asking each one of you to name one barrier to your serving in a leadership role in the malaria fight, and what the impact of overcoming that barrier had on the malaria fight. And Dr. Karema, I'll start with you.
Thank you, Yacine. So first of all, I would like to congratulate Women Lift for this exciting conference. And I'm also thanking the organizing for inviting me to represent the women in malaria. So one barrier I faced was gender bias, of course, gender stereotypes. And many people think that competence or rationality or autonomy are characteristic of men. And usually when a woman occupies a high position, and this is in all sectors, not only in the malaria fight, you face the same situation. So I remember when I was a program manager, that for some new strategies or changes, I was submitting for my supervisor approval or the Minister of Health approval for policy changes. In the beginning, the document had to be cross-checked with other staff or external technical partners. So I had to work hard, read a lot, make connection and network with senior malaria experts. This has helped me to deliver at my best. So all the negative performance expectations were overturned as my contribution became unquestionable. And my task competence was high. Of course, with tangible, we saw in terms of achieving high coverage of malaria intervention and reducing the malaria burden in Rwanda. Although that competence, as well as all the results, unfortunately, the stereotypes remain. So I faced the backlash effects. So I was competent, but stereotyped as a bossy and of course, unlikable. So what I think is people see you through their lenses, but when you work hard, their lenses finally adjust.
Thank you so much, Corine. This is very interesting how, your experience is really around this gender bias, but certainly, as you've rightfully said, when you are competent, it is what counts, and ultimately that competence is seen. So, we really salute your leadership and thank you for your contributions to the malaria fight. So I will now turn to Mambwe. And ask you to answer the same question, notably one barrier in you serving in your leadership role and the impact it's had in when you've been able to overcome that barrier.
Well, thank you, Yacine, for the question, and thank you for the organizers of this conference for inviting me to speak. I'm happy to be here. And indoor residue spraying specifically as an intervention for malaria has got biasness towards men folk actually, because it is a field that has historically been perceived to be for men folk. So there actually has been limited participation of female in the field of indoor residue spraying. And why is it like that? Because of societal norms, because of, for example, the dress code that we put on when we're in the field conducting indoor residue spraying, the gumboots, the overall, the face shield, and so on and so forth. But we haven't relented in this fight to have at least women participate in indoor residue spraying. So we've moved forward and introduced a number of measures as a project so that we attract as many women folk as possible in the fight against malaria through indoor residue spraying. Among the interventions that have been introduced are privacy for women, for example, at operational sites, and also we've introduced a lighter equipment we call a spray pump that women lift. Initially, they used to lift a 10-liter metal pump, but now there's a plastic sprayer which is a 7.5 liters, which is much easier for a woman to lift. And we've also gone further to continuously provide sensitization on female involvement in indoor residue spraying. And with these measures, we've actually seen an increase in female inclusion in the program. I'll give an example. In 2019, we were at 33% as a project with female inclusion in the program. And in 2020, last year, we jumped to 43% female inclusion. So we've seen an increase. So slowly and bit by bit, that barrier is being overcome. And what has been the impact of overcoming this barrier? So this barrier has actually moved proportionately with the coverage of indoor residue spraying and progress that the country has made over the years. So when we were at 33% in 2019, for example, we scored 92% spray coverage as a country. And when we increased the female inclusion to 43% in 2020, we jumped to 97%. So looking at this scenario, though it's not backed by any research or so, but actually there's a positive correlation between female inclusion and actually uptake of IRS and achievement of desired results. Yes, we are not yet there, but I believe we'll be there one time. Thank you.
Thank you so much. And certainly, again, thank you for your commitment to include women and to, put into place measures that are adaptable and innovative to be able to cater to women's needs to be able to do their work in the most efficient way. And congratulations on the progress that has been achieved. And certainly, for all of us, it is critical to have that female participation and inclusion and really be able to promote that. And as you've noted, we've seen that correlation even with respect to the impact. So I will now turn to you, Damaris, and ask you the same question. Thank you. So while Damaris joins us, maybe Elena, I'll turn to you first to answer the question, and then I'll get back to her after. Thank you very much.
Yes, thank you very much. Also, I join Corine words. Thank you, the organizers, for inviting me. It's an honor to be here, and it's an honor to share this panel with such a great women and scientists and fighters for this equality in the malaria field. About the question of which barrier has been more important in my experience, I think that talking from the researcher, from the experience of a researcher in Europe, working in Europe, I think that one of the most important barriers is the lack of a critical mass of women in research. This critical mass and the lack of women at the places where decisions are being made is very important at multiple levels, because we all agree that the scientific system need to improve, need to change, and need to be more diverse and more inclusive. Without women being part in this process of changing this scientific system, we are like limiting our abilities to make it a more healthy and more safer place to work. This is the first thing. And the second big barrier, if I can mention a second one, is the lack of empowerment. I think that one of the most important things when you work in research is to have a community that supports you, that empowers you, and that tells you that you can do it, and we are here to help you and to provide you with the training and with the resources that you need, and that you are good and you will make it. So this is, I think, something that without this critical mass, it's very difficult to survive in science as women. And this is what I am trying to contribute, working in like coordinating this women in malaria community.
Thank you so much, Elena. That was very to the point and very concrete in terms of actions to be able to overcome the barriers you've outlined, and certainly, with having more researchers, as part of a community, there is more opportunity for that empowerment. So thank you for your contribution. And I will now turn back to Damaris, and hopefully you are able to give us your thoughts and share with us your experience.
Yes, and thanks for having me. Quite excited and glad to be in this meeting, and thanks for the Women Lift for organizing this. So for me, the turning point was that I'm a molecular biologist, as you say, you had, but being deployed in a lab to do malaria work. But for the part of malaria that I'm doing is where you chase mosquitoes in the control of malaria. That's an entomologist. In this field, one of the things that we realize is that it's male dominated. This is from the lab to the field. So at that point, I realized is where are our ladies, the ladies who are trained in school, who are trained as entomologists, and why are they not going to the field as the rest of the men are doing? But I came to realize that this was because they're setting the traps early in the morning, carrying tools to the field. It was women were looked at as weaker sex, gender, like people who can't carry him. So for me, and this went cuts across from the lab to the field, but also to leadership. So the question that hit me is that we need to bring women on board. And therefore, having joined PAMCA to support the program management, even when you attend meetings, be it area meetings, that 20% of this said by specific, we all get infected equally, be it a man, be it a female. Therefore, my thoughts came in that for a long time, has been doing this. When you go back to the community, the implementers are the female. The women are the ones who take care of the children. They're the ones who roll out the bed nets that are distributed. They're the ones who are aware about insecticide indoor residual spraying that is being done at the homes, who are aware that this is the round that was done, this is the period that we need to do the spraying again, and even taking care of the children. Therefore, how can we bring these people who do the work very well at the community levels and reflect the same at the top level, that is leadership or at decision-making tables? So for me, the turning point was like, no, we can't be doing things the same again, repeatedly to expect different results. So therefore, we need to look for these female who are implementing the tools very well at community levels and bring them to leadership, to management, to be able to make decisions on the things that they do as the community. So since that time, we are trying to, at the Pan-African levels, we are trying to develop customized solutions for African population, but more so women-oriented, to be able to build capacity on women taking leadership on what they own or implement at community levels. Thank you.
Thank you so much, Damaris. And certainly, as you mentioned again, the importance of women leadership, of bringing women on board, of moving from implementation solely to decision-making, but also meaningfully engaging in decision-making spaces and really being able to have that leadership role that women rightfully deserve. So thank you again for those contributions. And I will now turn back to you, Dr. Corine, to tell us a little bit more about the work you've been doing, and more specifically, as the leader of the National Rwanda Malaria Control Program and really working in the malaria and NTD division during a time when malaria rates in Rwanda had dropped quite significantly. What was it like to be the first woman to serve in this role? And did it or did it not impact your ability to leave and achieve progress against malaria? And what changes were you able to make to ensure that other women would be able to follow in your footsteps?
Yeah, thank you, Yacine. Of course, it was exciting, but I was also afraid for the shoes to fill with the previous man before me, because he was a good leader. But most of all, I was afraid for the responsibility to bear as the first woman head of the National Malaria Control Program in Rwanda. So first of all, when I joined the National Malaria Control Program, I was the only woman senior staff because I was a medical doctor. And when I was appointed as the NMCP director, manager, we were only 2 women out of 15 head of different disease programs at the Ministry of Health. And I'm sure even in Africa, at that time, we were less than 5 women NMCP manager, and which is really unfortunate even in 2021. So at my appointment, I was as I say, I was the only woman senior staff. But when I left in 2016, 3 out of the 4 directors, the director of prevention, the director of case management, the director of neglected tropical disease were all women. Moreover, I'm thankful that 3 out of the 4 directors have followed me and joined me at international career. And the 4th is completing her PhD studies and is still the director of case management unit. So I believe that true leadership should be gender neutral. So being a woman is not a number on the road. It might be, for me, it might be even easier to implement where the men can't do. So, and the 15 years I spent at the Rwanda National Malaria Control Program is a living testimony of what we are currently proud of in the malaria response in Rwanda, and I'm sure that can be done in other African and in the African countries and in the world. So I believe that I've been empowered to empower, especially women. And of course, I'm lucky because I'm living in Rwanda. So the government of Rwanda has erected many laws to promote, empower gender equality. So I think that I've set the path at my best ability. I hope the subsequent women and men generation will be to promote both gender without discrimination. So what I'm doing now, currently I'm setting up a platform to build leadership and management capacity to improve the delivery of malaria control program intervention in high burden, high impact countries. So with the focus of gender intentional improvement of talents pipeline in country institutions through empowerment, promotion of women leaders in country. So I hope in few years, I hope to achieve building sustainable and gender equal pipeline of talent and human resource capacity in malaria elimination. And I believe that by fostering and growing gender balanced representation in malaria leadership and management, including policymakers, researchers, scientists, health providers, I'm confident that we will accelerate malaria elimination in Africa, because I think that as empower women, malaria experts, they will care more, and maybe they will ensure that all malaria policies, strategies are designed and developed with a gender consideration at the center, and then also all the effective malaria intervention are implemented to address malaria prevention, case management, and others across the life cycle of women and girls. Thank you.
Thank you, Corine, and certainly you've paved the way, and we look forward to supporting you and working with you as you develop this platform for leadership in high-burden countries across the continent. I will now turn to you, Mambwe. We've talked about how women are key leaders in the fight against malaria at community level, yet too often women are absent from leadership positions where decisions are made around the design, the delivery, the implementation of malaria interventions. What enabled you specifically to rise to the position you're in, and what difference is it making in the communities you're engaging with and the teams that you're leading? And if you could, I know you already shared some examples with us, but certainly maybe other examples around the impact on the acceptance of indoor residual spraying, as well as having women in these critical roles in terms of the change in perception.
Thank you, Yacine, for the question again. So from me, I'm where I am today because of 4 things. Number 1 is passion and interest in promoting community health. The second one is hard work. The third is commitment. And the fourth one is the results that I've achieved over the years. Why? Because before I joined VectorLink, I used to work with the government of the Republic of Zambia and the Ministry of Health, where I was the public health specialist. And I joined VectorLink as a district coordinator. I joined this project at that level, and I was coordinating 2 districts in the northern part of Zambia, that is Mansa and Chembe. So one of these districts, which is Mansa, had predominantly high refusals of indoor residue spraying. There was low community acceptance. Indoor residue spraying is a community-targeted intervention. So when the community has low acceptance, it means that the spray coverage and progress will be low. As a result, there was prolonged delay in completing the spray campaign. Mansa district usually completed their spray campaign over the scheduled time period of 30 days. So when I was posted there, Mansa district for the first time finished the campaign on schedule, that is within the 30 stipulated days. And based on that achievement, the project would assign me periodically to go and assist other district coordinators in their district to mentor them and support their district so that they could attain the same spray results as which was attained in my district. So the attainment of those results continued, and that being the case, the project asked me to provide technical assistance to other stakeholders in the country that are also implementing indoor residue spraying. For example, the mines on the Copper Belt province of Zambia, I provide technical assistance to the mines as well. So over time, I was posted to eastern part of Zambia, and I was overseeing Chipata district, which is a largely populated district of about 600,000 people. And I was given a target of about 167,000 structures to be sprayed in that period. And that high performance continued, and I continued on that trajectory. And over the years, I repeatedly earned myself exceptional evaluations at the annual evaluations during my prep with my supervisor. So when the position of country operations manager fell vacant, I applied and I was selected. Now, what does being a woman in indoor residue spraying bring to the floor? Being a woman in indoor residue spraying actually assists in high acceptance of the intervention. So why is it so? Because indoor residue spraying, usually the women are the ones who prepare the houses, who make the houses ready for spray operators to work in. So when they see women on the team, be it a spray operator, be it a team leader, be it a supervisor, be it myself, who's the operations manager, they get motivated, they feel more comfortable, they open their homes open to us, and this have seen increases acceptance. And not only that, there are also some communities, some locations within our communities that have limited access to male spray operators. I'll give an example. The Muslim communities, for example, do allow only female operators to access their households. And of course, in our culture, we've got these young girls who may be transitioning in adulthood, right? And when you find such a location, it is only a woman who's allowed to enter in that household and conduct the indoor rescue spraying. So having women on the team has actually accelerated acceptance. Of course, not disregarding the male folk, it's a team that we are in. So looking at the teams that I work with, we have female district coordinators as well. And currently these female district coordinators are motivated to even commit more to how they work because they view me as their role model. They now believe that someone can rise from a district coordinator to the position of operations manager only if you are committed and put in hard work. Not to leave my male colleagues as well. The male colleagues have been very, very supportive, and they believe that commitment and hard work is the only way to achieve. Thank you.
Thank you very much. So inspiring, and certainly role models are necessary, and it's really great to have you share your experience with us and the positive impact it's had within your team, but also within the communities. Elena, I will now turn to you. You mentioned earlier on that you coordinated the first Women in Malaria Research Global Conference and Networking Group, which I will note has its own Twitter channel at Women in Malaria. So if you have not already followed them, you should. This is a resource that connects women researchers across the malaria field. Can you tell us a little bit more about why you created this group and the conference, and what barriers were you looking to address, and the impact of this effort?
Yes, thank you very much for the question. So yes, the Women in Malaria community was born in 2018. I remember a visit in Glasgow where with Joanne Power, we decided to start this venture. So what were the needs or the necessity that we saw to create that group was because, as you know, as scientists, as women scientists, we all face those barriers that we have been discussing, those stereotypes, barriers, and biases that by simply being women in research and that you have to live with. But especially if you work also in the malaria research, you can also realize that those barriers and biases are even more acute or stronger because most of the research is being done on low and middle income countries where all these problems are magnified. So somehow those that problems of being a women scientist and working in the malaria field where most of the research is done in those countries where those problems are magnified, motivated the creation of this group. So the mission of the Women in Malaria communities has 4 main points. One is the visibility, to give visibility to women researchers, to create that critical mass. So we are there. And we are doing a great job and improving and making major breakthroughs in the malaria research field. The second was to make awareness about which are those barriers and those stereotyping and biases that affect the development of women researchers, their daily activities and their progression. The third one was to provide training to those that don't have the opportunities to have access to this training. For example, women researchers in low and middle income countries where the possibilities to have this training are less. And fourth, to give support through networking, through empowerment, and to provide as many resources in the form of mentoring, in the form of knowledge as possible. So with these 4 pillars was born this community. There is no a single person, we are many. We are now near 700 women researchers from all over the world, 54 countries, and we are still growing. Our hope is to become a legal association and to have a fixed and a continuous program of training and funding women researchers, and also to be open to men. So the goal of the women in malaria community is not to be an exclusive club, is to create a community of men and women that all work to eliminate discrimination and bias towards half of the scientific community. So that's the goal. About the conference was born on this philosophy with these 4 pillars, showcasing the work, the research made by women, provide training in the form of workshops, and also to serve as a networking platform. And we would like to continue with this endeavor and to have many conferences of that type.
Thank you so much, Elena. Damaris, I'll turn to you now to share with us from your perspective why it's important for women to get involved in the programs you work in, and what difference does that make in terms of the work that is done, and what more is needed for women to be able to enter and excel in your field.
Yeah, thanks, Yacine. And my apologies, have to be without video because my internet is unstable at the moment. So 3 key things that need in my field, which I said is entomologists. We're trying to eliminate or see ways we can control mosquitoes that transmit malaria. So here within the Pan-African Mosquito Control Association, we've developed what we call a women PAMCA intercontrol. And because in the year 2018, having been together in Zimbabwe, in Victoria Falls, here we realized the need, as I said earlier, to bring women on board and showcase what women are doing so that we are able to highlight or build confidence that whatever women do is also as good as what men do in the field of entomology. So why I think that we need to have these women and make sure that they are also seen to do effectively well is because they are able to implement these tools at community levels. As I said earlier, is that we must be able. I'm thinking the woman out there at home who is able to hang that bed net. So if the bed net is designed with that gender lens here, with a woman having a voice in it, the design will be able to speak to that community lady who is using it. Therefore, looking at ways to bring most of these women on board. So within the Pan-African Control Association, we have come up with this program, and this program is to do around 4 things. One of them, mentorship, because an area where we realize that senior women, these ladies who have been very, very successful, need to be able to mentor young women who are coming. And this in a way that they are able to see that whatever the senior ladies who are ahead of them have done, they can be able also to take up and run with it. And in the process, have more ladies working on malaria, have more entomology work. The other thing is training. One of the areas that we've realized so far is that women, we judge ourselves harshly. This way, this is where the thinking comes from. You tend, before you apply for a job, or before you take that opportunity out there to be a leader, you weigh out, you look at that advert and you say, I don't fit it. This does not happen to the men out there. Then they go ahead and apply for this opportunity. So for us is to train our ladies within the Pan-African Mosquito Control Association to develop confidence in themselves, to become better leaders, to be able to communicate effectively, and to have the skills needed for them to thrive in this field. So that's among us the things that we are doing. The other thing is to networking. I know Elena has mentioned networking within the malaria community, but also we realize that we don't know where those successful ladies, or we don't have examples that we can point out to. This is not because they don't exist, but it's because we don't have that database. We don't have that platform that actually women and people. Therefore, we build a network of these entomologists and be able to link them to be able to provide guidance, to be able to provide, to showcase what they have done. And if they have done it very well, then the young and upcoming can imitate and also implement and then thrive in that field. The other thing is to connect with the non-professionals. Yes, most of the time we tend to work with research scientists, policymakers, academia, but we forget the non-professionals. There are those people in the communities who are actually are able to eliminate mosquitoes, who are working around areas of malaria control. How do we bring them on board so that malaria can be of the past in areas that it's endemic? Therefore, within the PAMCA, we are working with non-professionals, those who can do indoors mosquito spraying, those who can do implementation of bed nets, those who are able to do larviciding, etc. So trying to work with them and champion and build confidence in them that whatever they are doing, they can do it very, very well. So I think that's what, and how I see this helping the community is for us to be able to be happy, a happy community, because the mothers or the women work not only for other women, but for everyone else. And as I said earlier, it's only a fool who does the same thing again and again. Having the 70% men representation in leadership, and we haven't succeeded in eliminating this disease, we need to turn these tables by having 70% of women in this field. So that's where we are headed as PAMCA. Thank you.
Thank you, Damaris. And I'll start with you with the last quick question, 30 seconds each. If you had to name one investment or solution needed to ensure that women were able to lead the malaria fight in their communities and health clinics, in research labs, in government, at national and international organizations, what would it be? Damaris, I'll start with you, and then I'll continue with our other panelists. Okay, well, Corine, I'll move on to you while Damaris is solving her technical issues.
So for me, it's gender transformative and intentional mentorship and capacity building.
Very clear, thank you. Mambwe.
For me, I think it's policy change and also girl-child education. Thank you.
Thank you very much. Elena, what would it be for you?
Yes, I share with Mambwe education training and community empowerment.
Fantastic. And Damaris, back over to you.
Women power and women resource.
Great, thank you so much. Unfortunately, our session is coming to an end. It was such a pleasure to moderate this session, and I learned so much from this very insightful conversation. Wanted to thank those who have joined us online and who have answered our polling question, which was what further action is needed to increase women's participation in the malaria fight. And the one that really came up with the highest percentage in terms of response was leadership and professional advancement, training, and opportunities. So very much aligned with what our panelists have shared with all of us. On a personal note, with Speak Up Africa, that I founded 10 years ago, our goal was really to be able to champion solutions and really ensure that we're addressing challenging public health issues, but also ensuring gender equality. So it's a privilege to be in this conversation with all of you, and I look forward to what we can do together in the future, and certainly look forward to continuing this conversation. We all know that when women are empowered with decision-making agency and valued as health workers, health professionals, they can improve maternal and child health, reduce malaria's impact on health systems, and lift themselves and their families out of poverty. So it's been an honor for me to hear from all of you and who are proving every day that women can and should be at the forefront of improving health. So wanted to thank you again for your time and your insight.